Hello and welcome to A Healthy State, a series where I talk to doctors and other health professionals about important health topics. I'm Dr. Nelu Simmons. Thank you for joining me. Now, the COVID pandemic has seen over 700 million cases worldwide and over 6 million deaths. In Australia, we've had 11 million cases in total and 21,000 deaths. It has impacted every single one of us in so many ways for the past 3 years. Health, mental well-being, the economy, travel, everything has changed. And while we are slowly finding what we call our COVID normal, we cannot deny that the impact this has had. And the reality remains the virus is still active and changing, and we need to stay up to date with credible information about it. So in this episode, we're going to get an overview of COVID, the symptoms, treatments and immunisations available. And we will look at what you can do to help reduce the spread and reduce your chances of catching it. Now, here to give us an update on COVID is Dr. Andrew Gan. Dr. Gan is a general practitioner who sees patients from all walks of life and sees firsthand the effects of COVID on the community. To give us an update about what COVID is and the importance of immunisations, I am pleased to welcome Dr. Gan. Welcome to the studio, Dr. Gan.
Thanks for having me today.
You're very welcome. Now, let's start by chatting about the current state of COVID. It's been around for years. We all know about the pandemic. Is it still a problem? Is it something we need to be aware of?
Certainly. So we know COVID is an airborne respiratory virus that's been spreading worldwide since the beginning of 2020. We know it's still around. We know that there are people in the community who have it, and we know that there are people in hospital who have COVID as well.
Now, there's a lot of myths around about COVID and what it is, how to treat it, how to manage it. Can you debunk some of those myths that are out there for the viewers, please?
So certainly, one of the biggest myths I come across is that if you've had a COVID vaccine, you'll never get COVID. Now, that is not true. The vaccinations and immunizations for COVID work very well to protect your immune system so that if you happen to be exposed to COVID, you'll recover more quickly, but you can still get COVID.
Are there any other myths that you see through your work as a general practitioner?
So lots of people have different ideas about COVID. They might have a bit of a sniffle, a bit of a cough, or just feel a bit tired or run a bit of fever and say, it's not COVID. But to be honest, any of these could be symptoms of COVID.
Okay, so can you just update for our viewers what the main symptoms are of COVID and what they should do if they do experience them?
We know a lot more about COVID nowadays than we did 3 years ago. We know that people with COVID may have symptoms such as fever, sore throat, cough. They might have muscle aches or might feel weak or might have a sniffly nose, or they may have no symptoms at all.
And what are some of the more serious symptoms of COVID?
In people with severe symptoms of COVID, they might have difficulty breathing, they might feel very dizzy, they might feel very tired, they might even lose consciousness.
Gosh, so it does sound like it can be serious.
It can.
So are there any treatments available for COVID? We know it's a virus, can't treat many viruses, but is there anything that can be done to help?
Australian Government has brought in antiviral treatments that reduce the severity and hasten recovery of COVID-19 in people, especially people who are old or frail or may have a weakened immune system. These antiviral treatments are available through your local GP, and they will help lessen the severity in people more susceptible to COVID and its after effects.
Okay, so this isn't a treatment that anyone can get. It's something that the GP has to decide if you're eligible for, is that correct?
The procedure of getting this varies from place to place, but in my clinic, as it is in many other clinics, we have warned our patients who are old or frail or have weakened immune systems that if they happen to have symptoms of COVID and if they have done a COVID rapid test that shows a positive reading, that they should get a phone appointment with our clinic on the same day, and we will arrange for a supply of these antiviral medications to be delivered to them on the same day if possible.
Great. And then are there any other treatments or supportive therapies that can be used in hospitals, for example, for patients who are suffering from severe COVID?
There are a range of medications that are available for people who are suffering severe symptoms of COVID and need to be hospitalized. This includes medications through a drip. This includes medications to help support their airways and their breathing as well.
And what about the vast majority who are unwell but well enough to be at home? What sort of treatments do you think you could suggest for them?
There are still a number of treatments that will be beneficial in these situations. I've asked all my patients to think about what if they get COVID and to have some emergency supplies at home. This might include Panadol or Nurofen to bring down the fevers and to help with the muscle pains. It may include a thermometer to regularly check your temperature. It may include an oxygen saturations probe to check your oxygen levels, and to have emergency supplies of food and water if you are unable to leave the house.
That is really good advice. I often give that same advice to parents of children. Paracetamol, ibuprofen and fluids are definitely the mainstays of COVID and other viral treatments for kids. So I'm pleased to hear that it's the same for adults.
Certainly.
So it's some great advice for viewers at home who are trying to prepare for if and when they do get COVID. Now, the last thing I want to discuss is immunisations. There's been a lot of chat about what immunisations are available, do they work, do they not work, how many do we need, and the recommendations are constantly changing. As it is at the moment, is there a vaccine that's useful, and what do you recommend patients do for this?
I understand it can be hard to keep track of all the advice, especially when it gets updated and changed every few months. At the moment, all adults are recommended to have a booster dose of COVID vaccination if they haven't had one in the last 6 months or if they haven't had COVID infection in the last 6 months. The latest trends of COVID vaccinations that are being rolled out include protection against the latest Omicron strain and will be beneficial to protect yourself from the latest strains circulating.
And where can viewers go and get these vaccinations?
These COVID vaccinations are still available through your GP clinics, through many pharmacies as well. There are websites where you can search and look for the closest COVID vaccine provider in your area.
And are there any groups of people who you really strongly recommend the vaccines in?
I strongly recommend the COVID vaccinations in people who are more susceptible to COVID, whose bodies might be a bit more frail. This includes people over the age of 60 or 70, includes people with chronic illnesses, and people with weakened immune systems.
And what about in pregnancy? Do we recommend the vaccinations then as well?
Absolutely. We do know that pregnant women are more susceptible to COVID, and we do know that pregnant women who happen to get COVID do suffer more than non-pregnant women, and we do know that these vaccines are absolutely effective and safe during pregnancy.
Yeah, I can vouch for that. I've definitely seen a few premature babies born in the setting of mums having COVID. So I agree. I think it's really important that we encourage all of our viewers, particularly those who are pregnant, to go out and get their boosters. So who do you think patients can turn to if they have any questions or concerns? Is a general practitioner a great first port of call for this?
Absolutely. A general practitioner will be able to give you unbiased and accurate advice about COVID vaccinations. If you are unsure if you're eligible for the next COVID vaccine, your general practitioner or local vaccine provider can help check when was your last COVID vaccine. And if you have any further questions about the safety or effectiveness of vaccines, you can approach your general practitioner as well.
Great. So do you think COVID's something that's around to stay? Is this something that we should all just keep constantly thinking about, at least for the next little while?
COVID has been around for the last 3 years. We know a lot more about it nowadays than we did 3 years ago. We know in the majority of cases, people who are vaccinated will run the mild course and will recover. And we know that there are treatments and there are vaccinations and things that we can do about it.
That's a fantastic summary. Thank you so much, Dr. Gan, for joining me today. I hope you found that useful. I certainly did. And like you said, COVID sounds like it's going to be around to stay. So we need to think about what we can do to prevent it and to treat it and to protect ourselves and our loved ones against it. So thank you so much for going through all of that.
It's been a pleasure. Thank you.
Now I'd like to introduce haematologist Dr. Nada Hamad. Dr. Hamad specialises in blood cancers and bone marrow transplants and has an interest in COVID prevention, particularly in these patients. Thank you so much for joining me today, Dr. Hamad.
You're most welcome. It's a pleasure to be here.
Now, we just had a bit of an update on COVID itself, but I'd love to move on to what we can actually do about it. So from your experience, especially dealing with the very vulnerable patients that you do, what can we do as a community to reduce the spread of COVID?
I think the most important thing to figure out as a member of the community to try and prevent COVID spreading to others is to recognize when you have it. So if you develop any symptoms, RAT testing, and if that is negative, then proceeding on to a PCR. And it is very challenging to do because it's not as easy as it used to be, but it's still really important if you do have COVID that you try and avoid spreading it around. That also applies to a lot of other viral illnesses because we forget that other viruses also affect the vulnerable. It can delay their return to work. It can delay and cause a lot of upheaval in terms of their treatment if they have conditions that need treated. So I think responsibility around your own illness, making sure you don't spread it around, wearing masks when you have symptoms, when you're outdoors and indoors is very helpful. And outdoors is not as important as indoors, but certainly in indoor spaces, it will be really, really helpful to make sure you're wearing a good, well-fitting mask, not a surgical mask, but an N95 or a P2 mask that is a respirator mask to avoid spreading the virus.
And around the time of the pandemic, particularly the height of the pandemic, there's a lot of talk about hand hygiene and sort of respiratory spread control. What are your thoughts on that?
I think it's become very clear that COVID is spread through the air. It's not so much through touch or, through coughing and spreading, droplets of saliva or anything like that. I mean, it does spread in that way, but the more common form of spread is through the air. It's like smoke. If you were in a room and there was a smoker in one side of the room, you're going to be able to smell it on the other side. And that's how COVID spreads. It's airborne. And so the focus on hand hygiene and avoiding coughing in people's faces, that's great hygiene in general. But in terms of COVID, it really is around protecting spread through the mouth and through the air. And that's why a well-fitted mask is really important. So there's no holes on the side where the air can spread. If you were smoking through a mask and breathing out, it goes out through the spaces in the mask. So a respirator is really, really key.
Great advice. Now, as a mum and a paediatrician, I know that kids are not ideal at keeping germs to themselves. Have you had any experience, or can you provide some advice for the parents who are watching about what they can do to help educate children about minimising spread? And I know this is an impossible ask, but any tips would be helpful.
Oh, this is one that I've dealt with a lot. So it's no secret. I had COVID 3 times. I've got long COVID from it. And, one of those occasions was getting it from my kids. And my kids are so generous with their viruses. They want to infect me with everything they have. I have an 11, an 8, and 4-year-old, and the sharing is caring attitude towards viruses doesn't work. So I think that my advice is to educate children. And, the most important thing I say to my kids is that if you are sick, make sure you tell me so that you don't spread it to me and you don't spread it to your friends who also have families that they take these germs with at home. With my children at home, I'm very specific. If they are unwell, I will spread the rooms apart. So if I can, usually not everybody has spare rooms to do that. But I have a room upstairs where I'll send that child upstairs. I'd ask them to mask at home. And I even use a portable HEPA filter. And one of my colleagues in New Zealand said to me once, children are really smart. And if you talk to them about air ventilation, these things they can understand. And one of the strategies in a public health setting in New Zealand in a school, they asked children what would they do in the setting of a very offensive fart. And a lot of the kids said, open the windows and get out of there. And so with my kids, I say, if you're sick, we need to ventilate, open the rooms. In your school, if you see someone coughing or spluttering or sneezing, ask the teacher if you can open the rooms, the windows. And I think, with the portable HEPA filters that we have in our house, they're very quick to use them. My kids are very happy to use those HEPA filters. They think they work really well for farts, so they'll work well for COVID.
I love that. So some great advice there for parents. Now, this is a great overview on what we can do as a community to help reduce the spread. But on the flip side, what can we do ourselves to minimise our risk of actually catching COVID? And I know this goes for all other respiratory-borne illnesses, but any tips for the viewers out there?
Yeah, I mean, I think one of the things to remember is that the more times you get COVID, the more likely you're going to get long COVID. And nobody wants long COVID. I can attest to that, because it really does impact your quality of life, your ability to participate in your family, in your workplace, and just to enjoy life, being able to go outside, go for a run, and do the things you love. So avoiding COVID is actually quite a smart thing to do, because it's still relatively new in terms of what we know about accumulating infection. And one of the things about COVID now is that recurrent infections is relatively common. Most people have had it at least once, if not twice, 3 times, and even 4 times, I heard recently. And so getting vaccinated is really helpful. It just brings down that likelihood of getting infected just a little bit. It also reduces spread to some extent. It's not foolproof, so you have to do additional things. So if you're in a place that's really tightly packed, full of people, and you can hear them, I go to the theater and I hear people coughing and spluttering, take a respirator mask. Take a mask that's well-fitting, make sure you wear it. If you are going to be in a very open, well-ventilated space, that risk isn't as high, so you cannot necessarily wear your mask. If I go to the markets on a Saturday morning, I don't wear a mask. But if I'm going to the theater or to the movies with my children, I'm wearing a mask. And so that awareness around the spaces you're in is something we all have to learn to do from here on. I think, everybody knows what it feels like to be in a stuffy room, but you can buy little CO2 monitors if you're so inclined to tell how well ventilated a space is. Don't feel afraid to ask other people to mask if they're coughing, and don't feel afraid to say, I think we need to open a window. It's getting a bit stuffy in here, or people are coughing and sneezing in this room.
Great advice there. Now, you've mentioned a few times long COVID. Do you mind just describing briefly for our viewers what that actually means?
So long COVID is a term that kind of came out in the midst of the pandemic, essentially from social media. People didn't know what to call it when the acute illness or the illness, the viral symptoms had gone, but something else happened. People started to not recover or were feeling even worse a few weeks to 6 to 8 weeks later. And so the WHO and clinicians started to kind of recognize this phenomenon. And it encompasses a lot of things. It's a lot of conditions. Essentially, it's complications of COVID. It doesn't have to be severe COVID. It can even be mild COVID. I had mild COVID 3 times. And I went through the infections. I recovered to some extent. I just wasn't quite right at the end of that recovery. And things started to get worse 4 to 6 weeks later. And they range from things to being just really tired, or not being able to think straight, not finding words that you would normally be able to do. Your working memory is not that great. Your muscles aren't just as strong as they used to be. Breathing may be difficult, chest pain, palpitations, your gut might not be right. So it's very different for people from different backgrounds and with different underlying health conditions. But ultimately, the definition is these problems weren't there before COVID. They emerged after COVID, and they're not going away. And it can take a long time for people to recover. It varies. Some people recover within 6 months, others it takes a year, and sometimes people have some residual effect. But we've also noticed that after COVID, the risk of heart attacks and strokes has gone up. So it may not necessarily be apparent, but it may come in the form of a medical event that you weren't expecting, particularly for, let's say, an age group. So I think if you're not feeling right after you get COVID, it is worthwhile seeking medical attention from your GP, or letting people know that you're just not who you used to be compared to what you were like before COVID.
Oh, I'm sorry to hear that that's happened to you, but thank you so much for using your own experience to educate our viewers. That's so helpful. And it sounds like there are plenty of reasons why we need to keep COVID in the forefront of our minds in terms of reducing spread, reducing our chance of getting it. So thank you so much. And I really appreciate you taking the time to join me today.
You're most welcome. It's a pleasure.
Thank you for watching A Healthy State. I hope you found the information helpful. This episode and the rest of the series is available to stream on CTV+. I'm Dr. Nelu Simmons, and I will see you next time.